Jenny Hart, Democrat. Back May 1st, 2017, you met with Jake Tapper.
Well,
and
I don't think I have ever met with Jake Tapper, but I have been on his TV show. Yes, I've been on his TV show.
Okay. To do with healthcare. Your quote was, "It will allow insurance companies to require people who have higher healthcare costs to contribute more to the insurance pool that helps offset these costs, thereby reducing the cost to those people who lead good lives. They're healthy. They've done the things to keep their bodies healthy. And right now, those are people who have done things the right way and that are seeing their costs skyrocketing." Now, I'm assuming you're free and clear of your prostate cancer?
I hope so.
Okay.
That's what the doctor says.
What did you do wrong to develop prostate cancer?
Well, you're taking that quote entirely out of context and distorting it.
No, I'm not.
All right?
No, I'm not.
Please have a seat, and I'll let you get back out and talk. And I'm going to talk about that quote, assuming that it's accurate, and I'm doubtful that it is verbatim.
I have one more question.
I'll let you finish up, and I'll let you have more time. But we're on this part now, and I'll let you hit on whatever you want to hit on, and follow up on whatever I say you disagree with it.
I'm hitting on it. I've got one more question.
All right, well, I'll try to segregate. Remember that question, now second question, but I may forget.
I'll go back to the first one. Should your gold level Obamacare change, and should you receive less federal subsidies that cover 72% of the cost of your premiums? In other words, we basically pay your healthcare costs.
Let me get to the first question, and then we can talk about the second question.
What have you done wrong?
Okay, what you're saying is right off fake news and it's distorting it and it's not truthful.
These words came out of your mouth.
No, you have distorted what I have said. And let me have a seat now, and I will say what I'm going to say.
I'll have a seat when I'm ready to have a seat.
Okay, well then stand up and just be quiet so I can say my comments. That's what I just, okay, good. This is a statistical fact that the Democrats have distorted in an ugly way for political advantage. The fact of the matter is, if you look at the actual quote, what I was talking about is people who live good, healthy lives, people who follow their doctor's instructions, people who don't smoke, people who get exercise and are not obese, people who are not addicted to narcotics, people that eat the right kind of foods that the doctor wants you to eat, they pay less for health care because they get sick less often. That doesn't mean that 100% of them never get sick. It means that they get sick less often because they're leading the kind of lives that their doctors want them to lead. They're following the advice of their doctors, and as a consequence, they're healthier than they otherwise would be, which means their healthcare costs are lower. It's about like who pays more for milk? People who go to Walmart and buy milk, or people who don't go to Walmart and don't buy milk? Who pays more for milk? The people who buy it. The same thing for healthcare. If you've got people who are leading good, healthy lives and doing the right thing, then they get sick less often. So since they get sick less often, they have to pay less for healthcare. Now that is a fact in anybody's book. Okay? That's not an opinion. And you look at actuarial tables that insurance companies look at, and they will confirm that. So what this lady is doing is relying on false information and distorting it, as the Democrats have been wont to do in this healthcare debate. And it gets me angry when you and other people like you intentionally try to deceive the public on this issue.
And it gets me.
Do you agree that people who are healthier because they've done the things that doctors recommend to do to get healthier?
My first question was, what did you do wrong?
It's the statistical probability. It's not everything.
And how dare
some people lead the kind of lives that doctors recommend to lead, and they still get sick.
A person with diabetes has done something, and some of this.
I have never said that. That's where you're lying.
Is yours hereditary?
I'm sorry, but I'm telling you that when you say that the words you just put in my mouth, you're lying. It's as simple as that. It's as simple as that. I don't want you slandering people by distorting what they say.
Does not ask for cancer.
Nobody said that. All right, now the next question is dealt with the contribution that the federal government makes to employees. I don't know if y'all know this, but every single federal government employee who works full-time gets their insurance, health insurance, paid in part by their employer. It's the same thing that happens with most people in the private sector. Now here's the interesting thing you may not know, and that is that senators and congressmen get the least amount of contribution to the cost of their health insurance than any other federal employee. The least. Not the most, as this lady would suggest. Okay? Let's just make sure everybody understands that it is
Do you not have
the least.
access to free health care?
No, I don't.
Through the office of the attending physician in DC?
No, I don't.
Oh, you don't?
No, ma'am. No, I
You're
don't.
the only one.
No, ma'am. You've got more false information. You have to pay.
This is off the government website.
I'm sorry, I have no idea where that information
You have no
came from,
idea.
but I know from personal experience that it is false.
Do you not
Okay.
get free medical outpatient care at military facilities in the DC area?
I have no knowledge of that because I've never used them, so I don't have personal
Well, you
information.
You
But
do.
I do know that to use the house
You're
physician,
welcome.
you have to pay for
You're
it.
welcome.
You have to pay for it because they take it out of my paycheck.
You're welcome.
Okay? I'm sorry, it's false.
Got a different question.